Hello, my geniuses. Welcome to another anatomy lecture series. Today is your great science Lorenzo. I'll be talking about the quadrangular space. The quadrangular space is part of the subscapular spaces, or you can call it the intramuscular space in the scapular region. So it's very, very important because it's an important landmark that transmit neurovascular structures from the word axilla. So stay to the end of this video. I'll be giving you a useful mnemonics and demonstration so that you remember the subscapular spaces for your word exams. So if you are just joining me, make sure to subscribe and turn on your post notification button so that anytime I drop any video, you'll be sure to be notified. If you want me to make a video, like I will always say, drop it down in the comment section, or if you have a correction, you can also drop it down in the comment section so that anytime I check it, I'll make sure to correct it or make that video personally for you. So let's jump right into the video. Welcome guys to another species of the upper limb. We have talked about the axilla, the cubital fossa, anatomical snowball, carpal tunnel, and all these are large spaces which transfer neurovascular structures from one part of the upper limb to the next part of the upper limb. So, but they are still little spaces. We call them the subscapular spaces or the intramuscular spaces of the scapular region. So we'll be touching them one after the other so you can also understand, because they used to ask it during exams. Now the first one is the quadrangular space, while the second one is the triangular space. We're talking about them one by one, so be attentive and you write it down so in case you see it in your exams. So the first one is the quadrangular space. So what is the quadrangular space? The quadrangular space is an anatomical space in the posterior axillary region. So it's present posteriorly, not anteriorly, and it just provides a space for the transfer, or it provides a conduit for the transfer of neurovascular structures from the axilla to the posterior compartment of the arm. So we're dealing with the quadrangular space. One, you should know that the quadrangular space is present in the posterior part of the axilla, and it transmits neurovascular structures from the axilla to the posterior compartment of the arm. So first of all, what are the boundaries there? So what are the boundaries? So you can easily see the boundaries. So you do your hand, you cross two of your hand on top of two of your hand. So what part of your hand? You are using your index finger and your middle finger. If you cross your index finger of your right hand to the index finger of your second hand, you can easily know it like that. So you are seeing it on your screen. So for the first boundary, we have superiorly. So what is bounding the quadrangular space superiorly? Superiorly, it is bounded by the teres minor, posteriorly, subscapularis, and the capsule of the shoulder joint between the two muscles. So superiorly, very simple, it is bounded by the teres minor, superiorly. So you can also see for your exam, they can also say teres minor. Teres minor is bounding it posteriorly in the superior region, and it's also bounded by the subscapularis anteriorly in the superior region and the capsule of the shoulder joint between the teres minor and the subscapularis. But majorly in some texts you can only see teres minor. But now you should also know that there are other parts in the superior boundary apart from the teres minor. Don't forget. Inferiorly, you can see the teres major. So if you cross your hand on your two hand now, maybe your index and your middle finger on the index and the middle finger of your second hand, what happens? Superiorly, you'll be seeing that one that is on top is called the teres minor, naturally, while the one below is the teres major. Laterally, now it is bounded by the surgical neck of the humerus, laterally, while medially it is bounded by the long head of what? Triceps. So easily, if you want to know superiorly, teres minor, inferiorly, teres major, laterally, surgical neck of the humerus, medially, long head of the triceps. So what transmits through this quadrangular space? It transmits what? Axillary nerve and posterior circumflex humeral vessel. Axillary nerve and posterior circumflex humeral vessel. Put your hands together, you see a quadrangular shaped space. So when you put your hand together, you can remember the quadrangular space, the boundaries. On top, teres minor, below teres major, lateral humerus, medial, long head of triceps. Now, what is the clinical correlation here? The clinical correlation is what we call quadrangular space syndrome. What is quadrangular space syndrome? During surgical neck fracture, there could be what? Damage of the what? Axillary nerve and the posterior circumflex humeral vessel. Either surgical neck fracture, or you can have compression. Compression can occur secondary to hypertrophy of any of the muscles around that place. So when there's hypertrophy there, what happens? It could damage the axillary nerve. Or when there's surgical neck fracture, you can also damage the axillary nerve. And when you damage the axillary nerve, you damage the deltoid and the teres minor, which means there will not be abduction, there will be limited flexion, extension, and also there will be difficulty in lateral rotation, because that's what the teres minor offers. So I hope it all made sense and you understood everything I talked about in the word quadrangular space. So keep watching my video. So I'll be moving to another space again, which is a triangular space in this subscapular region. So move to the next part. After this video, you move to the next part so that you can also understand, because there are two spaces. There's quadrangular and there's triangular. So I'll see you in the next video. Bye bye.